So today the topic we are going to discuss is acid-base balance. This is one of the most important topic in various exams and in entrance care units. So the scenario will be that we will be given something like the pH is this, and partial pressure of carbon dioxide will be given alongside bicarbonate concentration in the plasma. Using these given values, we have to calculate the acid-base disorder, which may be either acidosis or alkalosis. It may be either acidosis or alkalosis. Then we have to know that whether the acidosis is metabolic or respiratory. Similarly, when it comes to alkalosis, we must know that it is metabolic alkalosis or respiratory alkalosis. So now we are going to study how to interpret a given scenario about acid-base disorders. Before moving toward these steps, first of all, I will like to let you know the normal values of various parameters in the which are usually given in a scenario. The first is the pH. Its normal value is between 7.35 to 7.45. Then the partial pressure of carbon dioxide, it must be between 35 to 45 millimeter of mercury in a normal person, and the concentration of bicarbonate is 22 to 26 milligram per liter. Moving toward the steps, the first thing you are always going to look is the pH. The second thing is carbon dioxide, partial pressure of carbon dioxide. The third thing is the bicarbonate concentration. So when the pH is less than 7.35, we will call it acidosis. When it is greater than 7.45, we will call it alkalosis. The next thing, you must know that the carbon dioxide is acidic. So the partial pressure of carbon dioxide, when it is more than 45 millimeter of mercury, we will call it acidosis. When the partial pressure of carbon dioxide is less than 35, we will call it alkalosis. Moving towards the bicarbonate is basic, so increasing its quantity makes the blood more alkaline, more alkalosis. So the bicarbonate concentration, when it is less than 22, we will call it acidosis. When it is greater than 26, we will call it alkalosis. So the scenario will be given like that: a patient comes with 2 days history of severe diarrhea. When ABGs are sent, the reports are like the pH is 7.25, carbon dioxide partial pressure is 42, and bicarbonate concentration in the plasma is 18. So as I said, first of all, we will look toward the pH. If the pH is greater than 7.45, we will call it alkalosis. If it is less than 7.25, we will call it acidosis. So because in this scenario the pH is less than 7.25, we will call it acidosis. And then the second thing we are going to look towards is the partial pressure of carbon dioxide. The normal value is between 42 to 35 to 45, so it is and in this patient it is 42, so it is normal. And then we will look toward the bicarbonate concentration. The normal bicarbonate concentration was 22 to 26, and it is 18 in this patient, which means it is acidic. So 18 means acidic. And one more thing I had previously told you was that when the disorder is due to carbon dioxide, we will call it we'll call it respiratory acidosis or respiratory alkalosis. When it is due to bicarbonate, we will call it metabolic acidosis or alkalosis. As the disorder is due to bicarbonate concentration, so we will call it metabolic. So what this acid-base disorder this patient has? This has metabolic acidosis. This patient has metabolic acidosis.